Hi, and welcome to AAHPO's American Armenian Health Professional Organization's TV Health program. Today's topic is a common one, and it's an important one. It's gum disease, which can affect our health significantly. And our guest today is Dr. Gregory Kazanjian, who is clinical associate professor at NYU, and he is author of a book called Periodontia. Dr. Kazanjian, welcome to our program.
Thank you.
The gum disease is very common, and it really affects us terribly. How do you describe gum disease? When we say gum disease, what are we saying?
Well, gum disease, in essence, is an inflammation of the gums. It really splits into two types of diseases. One is called gingivitis, it's called periodontitis.
Well, let's talk about gingivitis first.
Yes.
What is gingivitis?
Gingivitis is an inflammation of the gums,
So
basically.
When you get gingivitis, do you get any bacteria in that section?
Yes, and we know that gingivitis, or gum disease in general, it is started by a bacterial form that exists around our teeth. And if we do not clean our teeth, we do not remove this bacteria, it will basically cause gingivitis.
What are the symptoms the signs and symptoms that people will see?
Yes, the earliest signs of gingivitis is redness of the gum. That's the beginning of gingivitis,
Is there
the
any
inflammation.
sensitivity to hot or cold?
Not with gum disease. Gum disease is called somewhat a silent disease as well. Gum disease doesn't hurt until it's too late.
And that's which periodontitis?
Which is periodontitis.
Right.
It's called periodontitis because it involves the destruction of that part of the body that holds the tooth in place. For instance, the bone, the jawbone, the gum surrounding that, and of course all the mechanisms that are associated with that, specifically the bite.
Is there any foul smell? Is there any other symptoms?
Yes, that's a very good question. We have a very bad, very fetish, we call it fetish odor, or a very like rotten egg type of an odor that comes from the disease of the gums. Bleeding is also a very important sign and symptom of gum disease because infection and inflammation, it leads to severe bleeding.
And there are certain bacteria
Yes.
that anaerobes especially affects the gums.
Yes. Yes.
What other bacteria besides this anaerobes?
There are all kinds of bacteria in the mouth. Earlier studies have shown something like over 400 types of bacteria. These bacteria are very, very elusive in that they hide deep inside the structure of the gum because they are being anaerobic.
That's what we say, anaerobic.
Yes, that's right. And being the anaerobic, they hide and
smell.
And they begin to eat.
Right.
The gum, and that smell that we smell is the odor of the bacteria causing the
gums.
yes.
And the treatment will be obviously an antibiotic, and what else?
Antibiotics is one line of defense. In acute cases, antibiotics is a very important first line of defense. But the second most important thing is to do a cleaning.
The gums and the teeth. So we know gingivitis is a systemic disease. It's not really local or periodontitis.
Yes.
We know it affects other parts of the body.
Yes.
Let's start with the heart first.
Tremendous number of studies that are, and ongoing studies in the past and still ongoing studies, trying to ascertain the relationship of gum disease, bacteria that's involved in the gum disease, and the inflammatory process, the cytokines or those signaling molecules in the inflammatory system that causes other problems, such as, for instance, as you mentioned, heart disease. Now, atherosclerosis and gum disease has been associated
With inflammation,
because they both have a common, as you said, inflammation. Right. With gum disease, there is one other interesting thing, in that some of the bacteria that exist around teeth, once they're in the blood system,
yes,
you know, they begin to stick to the blood vessels.
Right, because excessive clotting.
Well, exactly. The stickiness causes clotting, and then obviously emboli may be a very and a stroke is being the result. So while this is not a very common thing, and it happens in advanced disease, periodontal disease, but it can happen, right, and it is important
and
to
it affects the diabetics very badly. I know when patients come in, their sugar is not controlled well. We are looking for silent infection someplace, yes, and usually gums are the problem.
You know, you mentioned diabetes is very very interesting. Again, studies have shown that diabetes and gum disease, they're like they have a vicious circle between them, and that is that the more diabetes you have, there is a good likelihood that your gum disease, if you don't take care of it, it will be worse. Worse gum disease causes worse glycemic effect, which is really diabetes.
So really the heart disease becomes important, the clotting factors are important,
yes,
diabetes is important, and the joints, because inflammation is the same way. What happens to the joints if you have severe gum disease?
Yes, specifically arthritis, rheumatoid arthritis. For instance, rheumatoid arthritis is affected in a negative way by the same bacteria, strangely enough, that affects the gums.
We know now it's important to really take care of our gums and teeth. What is the routine recommendation for a general public? How many times they should brush? How many times they should floss the teeth?
Yes.
How often they should see the dentist?
First, it's very important that the brushing or the home care or home hygiene, we call, to be done right. Mm-hmm. 10-second brushing of the teeth is not really brushing of the teeth.
How many minutes?
So basically, I recommend by the clock. Right. I recommend 10 minutes. Between teeth, there is also bacteria.
Right.
Bacteria doesn't know the difference.
Right.
So we have to get between the teeth. There are some recent studies that have said that flossing may not be very effective, but all in all, I still recommend that flossing or some method of what we call interdental brushing be done between teeth.
At least they should floss.
Yes, in many ways.
Is there any differences between hard brushes, soft brushes,
yes,
medium brushes?
Yes. Usually there are two types of brushes: natural bristle and plastic bristle, so to speak. Which one would you recommend? The plastic is fine. They're cheaper.
Be hard or soft?
If you're using the plastic, you should use a soft brush.
Soft brush. Anything on the toothpaste? Is it any difference?
The toothpaste, basically, the fluoride is the main thing in the toothpaste.
Anything baking soda?
All these are fine to use if you like to, but they don't have very great scientific background.
Fluoride.
The fluoride is the most important.
Dr. Kazanjian, thank you very much for this enlightening information. Hopefully we'll see you in another program.
Thank you.
Now it's time for this week's article. It is dietary epicatecin and cardiovascular disease. Cardiovascular disease is leading cause of death and is responsible for approximately 30% of all deaths worldwide. Diet is an important determinant of cardiovascular disease. Plant-based food like chocolate, tea, and apple are rich in the epicatecin, and their consumption are inversely associated with cardiovascular disease risk. Clinical trials have shown that chocolate, tea, black or green, have improved endothelial health and reduced blood pressure. Randomized controlled trials have associated with green tea reducing fasting glucose and insulin, thereby reducing insulin resistance, which is an important risk factor for diabetes and cardiovascular disease. Recently, researchers from Netherlands investigated the association of dietary epicatecin intake with 25-year cardiovascular mortality in elderly Dutch men. More than 700 men aged 65 and 85-year-old were in the study for 25 years. In this study, risk of long-term cardiovascular disease mortality was 38% lower in men with highest epicatecin intake, which was 22 milligram a day, than with the men lowest epicatecin intake, which was 8 milligram a day. In men with cardiovascular disease, the association with cardiovascular mortality was even more significant, and it was 46%. In conclusion, in this study, higher epicatecin intake is associated with lower risk of long-term coronary heart disease mortality in elderly men, as well as men with cardiovascular disease. A daily intake of 22 milligram epicatecin to reduce cardiovascular disease risk mortality is equivalent to 6 cups of tea, or 54 grams of chocolate, dark chocolate, or 2 to 3 apples. Here is your daily recommendation: 2 to 3 cups of tea, green or black tea, 1 to 2 inch square of dark chocolate, and 1 apple a day. Good health is precious and priceless. Keep informed. For up-to-date medical information, visit AAHPO's website, aahpo.org. I'm Dr. Ohan Karatoprak. Until next program, so long.